Okay, good morning, good afternoon or good evening, wherever it is you may be joining us. Bearing in mind this is being live recorded and you may be watching it at your leisure later on. So welcome to this ANZSOG NRCoP webinar with the title, Are We OK? Co-Design and the Regulation of Psychosocial Hazards. My name is Grant Pink. I'm the Pracademic Advisor to ANZSOG's NRCoP, and I would now like to open the webinar by acknowledging First Nations people from all of the countries and pay my respect to them. We honour their wisdom and their stewardship of traditions, lands, waters and customs which enrich us all. Because of course ANZSOG is Australia and New Zealand, so we have our Indigenous folk. We have the Aotearoa New Zealand Maori, and of course this is beaming to other countries, and it's not uncommon to have people from Canada, South Africa, so First Nations is broadly interpreted. As I've mentioned, we're streaming live, but we also have ACT-based regulators from the ACT government and the federal government here in the room with us. They've been briefed to be silent, and they'll have their own questions after the camera stops recording, and they'll also benefit from some in-person networking. Before I introduce our speakers, a few points about the webinars. As we mentioned, webinars are recorded, and they will eventually be made available on the ANZSOG YouTube channel. We will also be preparing short videos of key points extracted from the total 1 hour video recording, and that'll be shared through social media platforms. We'll be using, as per usual, the Q&A function. So again, those who are watching and joining us on screen, live streaming, please send your questions through. We've allowed a good chunk of time at the end to go through those questions, and a reminder to upvote them. So if you see a question which is similar or you like, please upvote it and we'll prioritise that. And again, as per normal, we'll try to get as many questions as we can, but I was saying to the panel before we came live, I think most of these we're lucky to get through a third, but that's a good sign, I think. It shows that we're actually thinking about it all. So it's now my privilege to introduce the panellists who sit before you today, and they are in order from closest to me to furthest from me in the order in which they'll be speaking today, generally speaking. So firstly we have Jackie Agius. Jackie was appointed to the role of ACT Workhealth and Safety Commissioner in April 2020, and Jackie is also Commissioner of the Labour Hire and Licensing Scheme. And Jackie is an experienced leader with extensive practice both in industrial and work health and safety laws, and before being appointed to her current role, she was a Senior Industrial Officer with the Australian Education Union, ACT branch, and she's also worked as a legal practitioner in the ACT specialising in criminal law. So that's Jackie's background. Sitting next to Jackie is Frances Crimmins. Frances is the CEO, the Chief Executive Officer of YWCA Canberra, and having started her career in hotel management, she soon developed strong leadership and management skills which saw her take on senior human resources roles in the health sector. We're going to be hearing from both of those soon. And then we have Sian Leathem. Sian commenced in the Complaints Commission, as the Complaints Commissioner role in the NDIS, Quality and Safeguards Commission, in January 2022, and has 2 decades of senior executive experience in state and Commonwealth agencies across a range of roles, probably linked in the area of dispute resolution and broader regulatory areas. And prior to joining the Commission, Sian was the Registrar and CEO of the Administrative Appeals Tribunal. Just that word sends a shiver down most people in this room and on the line, I imagine. So which is, of course, responsible for conducting independent merits reviews of administrative decisions made under laws. And last but not least, Tracey Harkness. Tracey is a registered psychologist. I wish I knew that before I agreed to do this, with over 20 years of experience in behaviour support and disability as a practitioner, senior specialist psychologist and practice leader for the New South Wales Government. And she's also worked in non-government and government sectors and was a regular member of the New South Wales Restrictive Practices Authorisation process. So if you don't know what restrictive practices are, you're going to hear about them during the presentation today. So Tracey is passionate about improving inclusion of people with complex support needs and has a sound understanding of behaviour support in the reduction of restrictive practices. So welcome the panellists. What a wonderful lineup we have here today to learn from. And when I say learn, I mean share. Learning starts with sharing. So we have a plan. The plan for the session is we'll start with Jackie and Frances. They'll discuss their experiences in co-designing of psychosocial hazards for about 15 minutes. Then we will flow on to Sian and Tracey for another 15-minute block, and then we'll move to questions and answers. So, and as I've mentioned, given the hybrid event, we will prioritise and privilege the questions from the online audience in the first instance. So with that, I'm going to throw to Jackie and Francis, but I must admit, the first thing when I was asked to do this, I had to look up psychosocial hazards, and I've actually practiced saying it because it can be a bit of a tongue twister. I'm sure I'm not the only one. So could we perhaps start with a definition or a working title or understanding of psychosocial hazards, please?
Morning, afternoon, evening. It's great to be here, and thanks for the invite. And it's wonderful to be here, can I say, with three amazing women on the panel. Probably not too often that you see four women sitting on a panel, so really happy to be here with these fantastic women. Can I acknowledge that we're meeting on Ngunnawal land and pay my respects to elders past and present, and of course acknowledge all First Nation people from the land that you are joining us from. I'd also like to acknowledge the contribution that First Nations people have made to the health and safety of country over tens of thousands of years, and pay my respects to all First Nations people joining us for this webinar hybrid in-person panel. Often people ask what are psychosocial hazards, and psychosocial hazards or factors are anything in the design or management of work which increases the risk of work-related stress. A stress response is the physical, mental and emotional reactions which occur when a worker perceives the demands of their work exceed their ability or resources to cope. Common psychosocial hazards include low role clarity, workplace conflict, role overload, or poor organisational justice. And I just want to give a call out to some of my psychosocial team from WorkSafe who are here in the room, because they have put together this fabulous poster which really explains what common psychosocial hazards are. There are some outside for the people who are here, but if you're on joining us on the webinar, you can get onto our website, and I'm giving WorkSafe ACT a plug here because we want lots of clicks on our website. If you get onto our website, you can download these posters for free. So please go on and have a look. But they're very, they talk about that psychosocial hazards can lead to increased instances of workplace aggression, bullying, harassment, work-related violence, which can increase stress, fatigue, burnout, and reduce workplace motivation. And those things in turn may result in a psychological injury or illness. But if you check out our poster, it explains it really well.
So I should have looked the other side of my laptop, shouldn't I?
Would you like to read it?
I do. I mean, what a list. It seems to be pretty expansive, more inclusive list than excluding. The one that jumps out at me is role clarity, which I think I'll come back to, because in all of my regulatory research and consulting work with machineries of government, role clarity is a really, really big factor. So thank you for the definition, and over to you, Francis.
Thank you. And for those wondering what a non-regulator is doing on this panel and how I came to be here and work with Jackie, YWCA Canberra is actually a large employer. We have 350 staff in the ACT and region, but I'm also part of the community sector and have worked in this sector for over a decade, which is the second largest employer in the ACT next to government. I don't think people realise that. People assume construction is. And I nominated and was appointed as an employer rep on the ACT Work Safety Council. My primary driver for that was psychosocial hazards are the number one injury in the sector that I work in. And more importantly, we work with and do research on all of the things that intersect and impact girls and women. And sexual harassment is the number one issue that impacts and touches on more women, and we think it's greatly underreported. So I joined the committee with the distinct goal and aim of having psychosocial hazards, specifically sexual harassment, addressed in this term of the Work Safety Committee. Hence, I met this lovely woman sitting next to me, Jacqueline. And so that's how we started working together. And it was quite clear when we were looking at putting together a subcommittee on occupational violence that Jacqueline and I both have a really common cause around psychosocial hazards, occupational violence, which again, sexual harassment is a form of violence. So that's how our relationship commenced, and we worked on that. And we were really, I guess it was a very functional committee. We think we've come up with some really great recommendations for the ACT. And then it was through that relationship, I guess our expertise in doing research and hearing the voice of women, often women don't report sexual harassment, that Jacqueline approached me. We started having conversation about how our knowledge and reporting of sexual harassment, which we know is completely underreported, we've only just scratched the surface, and how that can help inform the regulators' approach as we start seeing, my prediction, a lot more reporting of this workplace injury, to make sure that we're not injuring and further doing harm to victim survivors. So that's a little bit of what Jackie and I are hoping to share with you today. Would you like to?
Yeah, sure. So one of the most important things I think about that co-design aspect is finding the commonalities. So Frances and I have some differences because Frances is an employer, and so WorkSafe ACT regulate Frances and her workers. But for us, it really became, how do we work together, respect each other's views, respect each other's differences, but so let's focus on those commonalities. And I was very surprised at being a part of this panel when Frances said to me, I only joined and nominated for the Work Health and Safety Council because I wanted to do something about sexual harassment and I wanted to do something about psychosocial hazards. So it was a surprise to me. It was only last week that I discovered that, and we realised that together we both had a similar story, because my aim at getting into work health and safety was to highlight the need to regulate psychosocial hazards in workplaces. So we had this amazing commonality, and that there's a level of respect for us. But from, I think, the other part of us working together is certainly as a regulator for me is to accept that Frances's organisation and Frances get to speak to victims who are too scared to speak to us as the regulator. And so Frances is able to be that voice for victims, which as the regulator we wouldn't necessarily hear. And already in some of the data that Frances has collected, we've been able to see that people are reporting sexual harassment to Frances's group more than they are to ours. So our psychosocial team conducted 500 workplace visits in retail, and only 9% of those workers disclosed that they had been subject to sexual harassment in their workplace, whereas Frances has shared some statistics and data with me that indicate that that it's a lot more than 9%. We're looking more at something like 3 out of 5 workers who report sexual harassment in workplaces.
And we've been working for a long time at YWCA alongside Kate Jenkins, the Sex Discrimination Commissioner. And I think the interesting conversation for us all is that this touches on 3 new legislative frameworks coming to the forefront. And for me, first and foremost, it's workplace, eliminating workplace sexual harassment and supporting employers to understand what that means for their workplace when we say you've got a positive duty, and what is a hostile workplace. And so working with the regulator and making sure that I'm doing my role as an employer rep to help other employers in the ACT understand these concepts. But because we have been doing work and research with women for so long, and the data is right, particularly young women, in our last survey, over 50% of young women said that they had experienced sexual harassment in the workplace. And for me, that's just not acceptable. As you introduced, my first career was in hospitality. That was in the late 1980s. And the rates, but the disappointing thing is the rates are not dropping. In fact, I think it's the underreporting. So that's, I guess, why I'm excited by this opportunity to make change, to make sure that our workplace regulation is supporting victims and survivors when they report. They've got other mechanisms such as Fair Work, and the Sex Discrimination Office will also have powers. So how do these all intersect, and how do we make sure that we're not forcing somebody to tell their story over and over? And when they do come through your door, how you respond is really important.
I just want to pick up on that point, because that was what was going through my mind when I was looking at the definitions and what it might include. And, you know, these people are in vulnerable, awkward positions. They don't feel empowered. The term triggering comes to mind. It's hard enough for them to tell their story to their employer or to a safe space. Then they have the regulator come along, and the regulator needs to take a statement, needs to verify some things, and they might feel that they're being challenged. So it's a compounding issue. And I think the stage whisper, if the microphones didn't pick it up, Francis was saying in the 80s in hospitality, numbers are going up. And again, from a regulatory perspective, that would suggest more egregious offending. Because in a way, I mean, not that people didn't know what they were doing was wrong back then, but there's been lots of media, lots of legislation, lots of enforcement, lots of compliance campaigns. So there's really no excuse not to know what's going on. So that's concerning. Yeah. But I wanted to pick up on that, the reinforcing and triggering nature of having to explore for good and proper reasons as a regulator, that we just need to be very, very mindful of that.
And I think exploring your own biases, this is entrenched in societal norms, and I think we have to accept that in Australia, that it's so normalised. Most people who are experiencing it are just told it's just get on with it. And I think if you're a regulator, you also have to look at your own biases and be open that maybe you're also looking through those societal norms that continue to perpetrate this form of occupational violence.
So in this instance, as we're sort of about to move over to hear from Sian and Tracey, it was circumstances and coincidence and mutual desire to progress things which brought you together. You had a lot of things in common, but you haven't always had the violent agreement. There's been a bit of respectful pushing back, which I think just reinforces the benefits of co-design. Anything you would do differently next time around, the next sort of co-design project you might be coming together for?
I think it's too early to tell, just because we're just embarking on this one. We're just about to start, so we've had our set-up meetings, we have connected people in both of our organisations, so that is beginning. Right now, and I only speak for myself, I can't speak for Francis, I'm really pleased with the way things are progressing. And I really think that we're on the same page. And that's an important thing. We must have that common goal. And the common goal for us is to do everything that we can to raise awareness about sexual harassment and psychosocial hazards in workplace. And so to educate, but also to regulate. And so having those commonalities, I think, put us in a really good position to move forward with our project.
And I would just add, it's about being open to having robust but respectful understanding. So you have to have, I think it's really good to have debate, because ultimately that gets the best outcome, but at all times it's respectful. So there might be points you can agree to disagree on, but I think if we all entered the room and we were all just yes people, that wouldn't get us.
And we've had a few of those discussions, haven't we, Francis?
Yeah.
So
can I do another plug? Great poster. We've also have a construction one. We'll be doing them also for different industries. There's a couple outside. You can also download them for free from our website, and it just, what we've decided and what our team have worked out, and they're fantastic, is that one of the things people say to us is, how do we control psychosocial hazards in the workplace when we can't see them? And what we say is, you might be able to see them, but you can hear them. So listen out for them and put some of these up in your workplace. And kudos again to both my comms team and psychosocial team for putting these together.
So there's the message. Click on the website, get a poster, get it signed by the staff that are here, for those in attendance.
How many times can we get that into the webinar?
Yeah, just have to speak to the editors. I've got lots of stuff scribbled down there. Thank you for that. I know it's probably a bit of a premature question to ask you how you do it again, but I think what I take away from your answer is you've had a strong relationship, a strong methodology, and even though you're still moving towards implementation, the relationship's strong and you do it again.
Oh, absolutely.
When co-design doesn't work is you're not even halfway through the first thing, you're saying, no, we wouldn't partner with them again. So I take that as a healthy sign. So if we can now go to Sian and Tracey about co-design in your regulatory world, what it is, what it means, and how you got there.
Well, Tracey and I were connected by the NDIS Commission's senior practitioner, Dr. Jeff Chan, who is effectively your counterpart, I guess you would say.
I realise my bio needs to be updated because that doesn't actually say what I'm doing now. So I probably should.
Well, this is like Regulators Anonymous. I mean, welcome to regulation, Tracey. I think most regulators think when they look at what they do in their day job, my job doc needs to be updated.
Yes, but I should have had it included in my bio for almost the last 2 years. I've been the senior practitioner in the ACT. With the aim of reduction and elimination of restrictive practices. There's an act and legislation that fulfills that role. Sorry. So yes, my counterpart.
Yeah. And that probably is the area where our agencies have the most interaction, is that shared interest and responsibility in reducing restrictive practices and implementing more positive behaviour supports for people. The human services environment, and particularly disability, is a really complex co-regulatory area.
Yes.
So lots of connections between our agency, state and territory organisations, public guardians, etc. So co-design is a really critical way in which we have to work all the time.
I mean, we've got different Commonwealth state responsibilities in the area of restrictive practices. So there's clear responsibilities for, in my position, to regulate and state and territory to do authorisation and consent of restrictive practices for NDIS participants. And the Commonwealth has a responsibility in terms of providing clinical leadership guidance, best practice guidance, and reporting on unauthorised use as well.
Can I just jump in, like I asked for a working definition to start
Yes,
with?
would you like a definition of restrictive practices?
I would, because one of the things that regulators do is they keep saying they're special and different, and they reinforce it by their language and their acronyms. So if we could just give people an idea of what restrictive practices are generally and some specific examples.
Sure. So restrictive practices, as a general thing, is covered in the National Disability Insurance Act, and it talks about any effect or anything that you're doing to someone in response to their behaviours of concern to control their movement or access to something. So there's 5 different definitions that are agreed with the Commonwealth regulator as well as other state and territory officials and myself. The first one is chemical restraint. So it's when someone takes a medication to control their behaviour. And like I said, each of these things have to be in response to the person's behaviours of concern that are causing harm to themselves or risk of harm to themselves or other people. So they're taking a medication to control their behaviour. The next one is mechanical restraint, where you're using a device like an arm splint to stop someone from self-injuring. That's another regulated restrictive practice. Again, to control or subdue someone's behaviour. The next one is physical restraint, which is using a part of your body to physically restrain someone, again, to reduce the risk of harm to themselves or others. And environmental restraint, which is around people's access to items or activities. So the most common kind of environmental restraints for NDIS participants would be things such as restricted access to particular sharps, straws, those sorts of things.
Fridges.
Fridges sometimes, yeah. Restricted access even to the community, so they can't necessarily go out by themselves. Sometimes that's about not being able to support, they require support to go out to the community, but other times it's for other reasons. And that's kind of a fairly common, I guess, scenario. And the last one is seclusion. So that's placing someone in a place by themselves where they are not allowed to leave. And it doesn't matter whether it's they're perceived not allowed to leave or whether it's an actually shut door. Often people with disabilities will have, unfortunately, restrictive practice has been used for a long time with people with disabilities to kind of control, their environment and control what they do with their, they have their own rights, constantly kind of challenged, I suppose. So that's the 5 categories of restrictive practice, and there's a whole range of other things that potentially, can happen with people that we wouldn't see as appropriate at all. So they would be things like be prohibited.
No, thank you. I think that gives us some good context. I mean, there's some things in there which we wouldn't like done to ourselves. So
well, that's
they
right.
need to be done for good and proper reasons, and then of course then
they
there's
need to be
regulators.
authorised and consented to. They need to have there's a whole range of requirements that have to happen. They need to be used as the last resort, be the least restrictive alternative for people, making sure that we're using positive approaches to people and trying to teach people skill building and all those sorts of things before we implement a restrictive practice to someone.
Okay, so we've got you here in the ACT, Tracey. We've got Sian up in Brisbane,
Yes, but national organisation.
but a national organisation, and you're saying off screen you're going to go to Sydney after this. So you get together, co-design. How did it start, and what are you focusing on?
Look, I think co-design happens in a whole lot of different contexts. For the Commission, it's really just a part of the way that we work. So, for example, we might become aware of a situation through a complaint or a reportable incident. Our priority is safeguarding the participant or any other participants that might be impacted, but we effectively co-design a solution to that situation. So we work really closely with the provider, with the participant, with any of their supporters to try and figure out, what's the underlying issue here? How can we actually make sure we've got a constructive approach here to be able to address it? So in that sort of corrective domain, co-design's a really important part of how we work. And I imagine Tracey will be working with providers regularly.
Absolutely. I mean, I think the ACT government is really good at doing co-design processes and practices in a lot of things, and that's co-design, and even with the National Disability Strategy, doing the ACT Disability Strategy, there was a big YWCA campaign to try and get, and kitchen table conversations, a whole range of different things to try and get as many views as possible. And I think, coming back to what was discussed earlier, if you have people that all have the same opinion, there's no innovation or anything happens about it. You really need that diversity of opinion from different people to make sure that you can get the best outcome, whether that's making improvements to your systems and all those sorts of things. I think the other co-design thing, and certainly in my own area in ACT, we've just done a YWCA campaign around which practices should be prohibited for NDIS participants, as well as the other parts that I regulate in ACT, which is kids in educational settings as well as kids in child protection services as well. So the regulation for those children and young people is also under my Act as well, which is the only jurisdiction in Australia that has that broader legislation. So certainly our regulation and co-regulatory model that I share with the Commission is around NDIS participants, but it does go a bit broader in ACT as well. Now, understanding, I guess the main thing to understand though is kids and children and young people in child protection education settings that have these restrictive practices are probably more likely to be kids and young people with disabilities as well. So the other thing, so we've done a lot of co-design just recently around what practices should be prohibited in people, and that's really things such as some physical restraint, procedures that are really have really deleterious effects on people. So in the historical, when I talked before about, these practices have been used with people with disability for a long time, some of these things have been really, really negative, had really negative outcomes, including death and injury. So thinking about things like prone and supine restraint, if you've got someone on the ground and you're impacting on their ability to breathe, that's something that should never happen. So there's a whole range of consultations we're doing, and I'm in the middle of writing a listening report at the moment in terms of hearing the themes of what we've heard through the community. And I think at this point in time, I think it's fair to say that the community is very supportive of us making it really clear about what should be prohibited in our space. There's just I think a big lot of our work will be rolling this out across the sectors and doing lots of education and guidance around some of those things as well. I think the other thing I'd like to give a shout out to is in the Community Services Directorate where I work, just a couple of blocks up the street. There is we have a great wellbeing framework in terms of the Community Services Directorate Wellbeing Framework. We've got an app that we literally, I think I downloaded earlier this week, called the Unmind app, and it's got meditation, it's got exploring of topics, you can track your mood and those sorts of things. They assure us that confidentiality of individual responses are not recorded, and they get aggregate reports of the users, tracking and user experience, which I think is really positive. I think the other thing that is really important in an organisation is to set a culture of being a safe space for people to talk about different things. I think it's really important for us to have a safe space to talk about where, certainly in the regulation space, it's making sure that we've got opportunities to think about how we work with providers, how we negotiate with providers, how we influence practice and all those sorts of things. It's really important, I think, for people to think through how the strategies that they can use and what they shouldn't be using and all those other, being aware of all the other kinds of potential pitfalls, I suppose, in regulation.
Now, Sian, one of the things that Tracey said then was about writing up a listening report. And Jackie had mentioned, with the sexual harassment, it's not always what we see, it's what we hear. Do you have any comments on, are you hearing more than you're seeing? Does that translate?
One of the, I think, good features of the complaints system that we have in the NDIS Commission is that you can be anonymous. So that does help, I think, give confidence to particularly a participant or a supporter that might have some concerns. They don't necessarily need to be on the record as the complainant, but we will take the information they give us and we will make our own inquiries and investigations in a way that is sensitive and tries to, if you like, protect that informant as much as possible. So I think that does give a level of confidence to people. But our biggest challenge, I think, is actually people understanding what their rights are and that they have the ability to make a complaint. So we are doing a lot of work about trying to raise the capability and confidence of participants to understand what they're entitled to expect from their supports and services, what a restrictive practice is, because a lot of people, whether they're a participant or a family member, or even in some cases support workers, don't recognise that locking a door is a restrictive practice, or preventing somebody from opening a fridge is a restrictive practice. So there's a lot to be done in terms of raising awareness by working with those communities too.
Indeed.
Yeah, and I think I've got a question brewing, linking a few of these things. But you made the point, Sian, about complaints and the importance of complaints and how they're good, they're good forms of intelligence. So, frequent listeners would know that ANZSOG has done a previous webinar on the importance of complaints and how you can use that to become more strategic in your compliance work. So those who came late, go back onto the website and have a look at that, which sort of does link in, there's a complaint.
And don't forget
to click. Yeah. You'll have to click on the WorkSafe ACT thing first to be redirected to ANZSOG's website. I think that's the way it's going to work. So, there's a complaint which is informal, which is intelligence, but it does come towards an allegation, which is in the space of regulators, What can we prove? What do we need to negate? And that's when the investigations and inspections start. So thank you. So I think by now we've got an overview of what sort of co-design looks like, feels like, or maybe sounds like, more to the point. So I'm going to sort of kick off with the first round of questions. And I'll give them all three of them to you at once to sort of set the scene, because I know that the questions and sometimes the answers will blend and bleed a little bit. But co-design, why do it in the first place? And then how to do it? And then where to next once you've got that platform. So I'm happy to go, whoever wants to go first. Why do it?
I'll jump in. Because we don't know everything as the regulator, and we must understand that and respect that there are subject matter experts, and we don't always employ those subject matter experts. So certainly, Francis and I There are things that Francis, and knowledge that Francis has that I don't have or that my organisation doesn't have. And part of one of those things could be just a very simple thing, which is how to ensure that the language we use isn't going to trigger a victim of sexual harassment. And so Francis's organisation can help us with our comms work and our education work to ensure not only that it's consistent, but that we're not going to impact on a victim further by using language that will trigger them.
Yeah.
It's a really good point. I think a lot of the time having that co-design approach helps you actually identify some unintended consequences of strategies that you might have, decided were a good idea, and they may well be a good idea, but there are other things that are going to happen on the ground when that's implemented, and you can really start to test that, I think, when you've got that good co-design process with partners who understand those practical implications.
I mean, I certainly think it helps to also identify any issues that may be sticking points for people on the ground, absolutely. When they're trying to implement a new strategy or a new framework or whatever, it's trying to work through those things and understanding, those things straight away so you can actually problem solve and, collaboratively work on those as you work through the process itself and consider those things. I mean, it goes back to Jackie's point before, we can't know everything. I'm a subject matter expert in positive behaviour support and restrictive practices, but I don't know everything about, people with disability all of the time because they're a very diverse range of people, so they're impacted by these things. So it's important that we get as many voices in the room as possible.
And I think we already heard your why do it, Francis. You were quite clear, but I wanted to raise the profile of this, so I thought the best way to do it was to get inside the tent and actively drive it. So that's your main why do it. Is there a follow-up why do it for you?
Oh, I think that we see in our work the harm it does to individuals. And I think if we're going to, and from our workplace perspective, it's the work we do in research, it is actually a form of gender-based violence. So that's why we're so interested, but as you said, being in a tent, but it's also in terms of the question on co-design. In all co-design where you can have the voice of the person who's experiencing it is really important. It's, nothing about us without us across whatever you're co-designing, I think is a really important principle. And particularly in your area of work with people with disabilities or other,
And I think, so you're talking there about lived experience?
lived experience.
Yeah, and I think this is where I'll bring my question out early, because I think this is the question that was building for me, and because I've been involved in some other work recently, it doesn't matter when you probably work it out, and so you've got these people who are really in vulnerable position. They're having things done to them for, well-intended reasons, but they do breach the legislation. So it's impacting upon the person. It's impacting upon the person who has to put the hands on to do it. It's impacting upon their family. Then the provider or service centre gets a complaint, so they have to then manage that. Then the regulator gets involved, and it's not a nice topic. You've got staff coming in who have to hear that, deal with it. Then they have, to my earlier point, they have problems talking to the victim or the person who's been done wrong by without triggering them. It's something which is bad, which gets worse and worse and worse. It just becomes massive. So, I was going to challenge you guys earlier about saying, come on, you're saying it's complex and co-regulation. Every regulator could say that, but there are some really uniquely challenging stuff that you're starting to layer for us in this space. So where I'm coming to with my question is, we've got our staff, we've got our audience, we've got regulators who are actually, to my earlier point as well, sometimes in unclear roles, and their job description hasn't been updated in a couple of years. And they're at the pointy end dealing with this. So I think that's another why we do it. We want to protect our people so they can help other people. So that's a little bit more of a monologue than a question. There's a lot in there, but when we look back around to our regulatory staff, what are we doing to support them? Any comment?
I certainly with my regulatory, I don't have a huge team of people. I've got quite a small team of people. We certainly have an culture within my team and branch of being very respectful of people's expertise in different areas. I have, when I think about it, a couple of people that aren't most of us have a clinical background of some sort, just because it's kind of where you end up in terms of doing behaviour support. But some people that don't have a clinical background, and they've got great views about how, something to keep us a little bit, hopefully less jargon or more jargon-free in our conversations. Also, they're a great measure in terms of what is easy to understand for general people as well. And then, of course, there's a whole range of other things we need to do with participants to upskill them and really explain them to have their rights, to be able to exercise their rights. My staff do go out and do inspections of residential houses and those sorts of things as well, and sometimes with the Commission as well. We certainly hoped at those inspections, we certainly encourage any person that happens to be there to talk to us, whether it's in person there or whether they can come back to us another time, and we're making it very kind of no wrong door kind of idea around getting information around those things as well.
Yeah. And if I now come to this end, a new book end, Jackie, what's similar and different for you?
Yeah, so, there are a lot of my people in the room, so someone might jump up and down and absolutely disagree with what I'm about to say, but I would hope not. We actually, for me, one of my absolute priorities is keeping my people safe, and my view is that if our people are not healthy and safe at work, they cannot regulate other workplaces to be healthy and safe. So one of the things that we have is an absolute encouragement of reporting, because my clear message is that if you do not know there's a safety risk, you cannot risk manage that risk. And so we have an absolute culture of reporting. If there's a report that comes in, that matter is discussed among the managers in that area, and things are put into place. So the sorts of things that we do, we have debriefing sessions, because particularly for our psychosocial team who are dealing with vulnerable people, they can be impacted by those people that they're speaking to. And I've certainly had some members of our team in my office crying with other senior management because of the things that they've experienced. We do things like, and have done things in the past, like close down our office for periods of time where there've been risks to our entire office, and that might, and we've gone to just reactive visits, no proactive visits. So there are a number of things that we'll do in our organisation. Some might be team-based, some might be whole of staff-based. But I think the very first thing that we must encourage is the reporting. People must report.
Yeah, no, I like that. I think there's some good messages there for regulators to think, if you can't see the risk, you can't manage it, and if you can't look after your own people, and or they don't feel safe, how can they go out and represent you and protect others?
Sorry to interrupt, Grant, but and I've spoken to people in the room, they've heard me say this before. When it comes to work health and safety, when we're on an aeroplane, we all accept, hands down, that when the oxygen mask comes down, we need to put ours on before we can help anyone else. And if we just take that message through to everything that we do, it's accepted on aeroplanes, but for some reason we don't accept that message in workplaces. And we need to make sure that we put our oxygen mask on before we help others, because if we can't breathe, we can't help someone else to breathe.
Good point, thank you. So I think the second question here is how to do it. So I'm going to sort of throw this to the middle of the group. So Sian and Francis, you've got this sort of nervous 5 seconds to shape an answer. So we're going to say how to do it. I mean, to give you a running start, I was writing down before, we're hearing about collaboration, coordination, consultation. So there's lots of C words around there. I mean, but so how do you do it?
I think the critical thing is to not have a prescriptive approach to co-design, but to actually be flexible to meet the situation that you're in. It's really, I think, about a way of working, and we've heard about respectful communications, being prepared to listen to different voices, but I think it also comes down to, particularly regulators, being prepared to give a little bit of the power over to the subjects that they're regulating, to have them involved in the conversation.
Well,
Because
you breezed over that quickly. I know there'd be a few people rocking back in their seat when you said that.
that is what co-design is, though.
So just say it again for the country viewers.
Yeah, you need to be prepared to give some of the power to the subjects that you regulate, rather than just being, the regulator who's dictating what needs to happen.
And how can we do that in practice? How can we do that in practice? What's a useful tip for them to do?
We do it in practice, I think, by making sure that you are actually creating those environments where you are prepared to, have discussion papers, hear what they've got to say, listen to the people who are in that area about what's working and what isn't working, and be prepared to, be a bit creative and think outside the box, I think is important.
And I've been involved in some of the co-design processes that you spoke about with CSD, and particularly if you're trying to work together on some really complex, some of the complex issues that you were just discussing. But I would also agree, I think we also have to keep it simple and don't overthink it. And I was going to say, can we putting egos aside can help, which probably goes to your point as well, that there's not one person who's
Has to be right all
has
the
to be
time.
right all the time, and that's where I've seen co-design go wrong. So yes, putting sometimes the ego aside can.
And I think it was Jackie, I think you kicked off with the need for subject matter experts, and sometimes they're not in your agency again. But I think at first pass, look around your organisation because you have got good people. I remember a story when I was in government. I thought I was really important, going over to France and doing some stuff with Interpol. And I was in a photocopying room a few weeks back, and I was photocopying stuff, and someone saw the logo, and I said, "Oh no," and I played it down. So I thought, well, they won't know. I don't want to bore them. And they said, "Oh well, my partner worked for DFAT and was in this country, this country, and this country, and I've done work for the UN and the UNODC and all these things." And I thought, this person's at 5 cubicles from my office, and so the point there is you just don't know who's in your agency. So I think this co-design is make sure you do acknowledge and identify the subject matters outside and inside. So that's good. So that's
And also click onto the WorkSafe OCT.
well, I think anyone who's trying to work in this space who doesn't do that well,
At your peril.
they need some special help. So with sort of 3 minutes to go in terms of my running sheet, so that's a cue to give me a soundbite. Where to next? I mean, you've touched upon that, so maybe we'll start the other end with you, Tracey, and we'll come this way.
Where to next? I think certainly the things that I really rang true with me with what Jackie said before around the respectful relationships you have with people, in terms of working on the commonalities and where the common ground is. You could have situations where, as a regulator, that you're really trying to, push through a particular agenda, for example, and pushing is not the way to do it anyway. With, people that are in different sectors and. And they're with certainly with different experts in other things, and you run the risk of kind of saying people then sort of not saying, well, you don't understand our context, you don't understand this, that and the other. So I think it's really important. I've certainly learnt a lot in the last few months around making sure we can develop those relationships on the common ground and working out where we can start from. And there's a really good, positive, respectful way to start.
Excellent.
I'd just say I think one of the challenges that we're grappling with at the moment is, co-design is a new way of working for lots of agencies, but when you're working also with people with disability, needing to get comfortable with supported decision making, and how do we actually create an environment where people who might have complex communication needs have a seat at the table and have a voice as well. So that's kind of the next layer of complexity, I think, for us.
I guess I'd respond from an employer perspective, and that is we want to get it right. I certainly know I don't, my fellow employers don't get up and go, I'm going to try not follow that regulation. We want to get it right, and so having that respectful relationship is really important to helping us who are on the receiving end of the regulation or trying to implement regulation, really helps.
Well, I agree with everything that everyone said, but I have to say I loved what Francis said today, and for me it's kind of the key point, which is nothing about us without us, and I think that really is something that we can all take away from today.
Excellent. Well, thank you. So I'm now looking at the Q&As coming in, and there's Harkness one that's been upvoted a fair bit. How do we close the gap between policy that sets out to reduce psychosocial hazards versus the reality that we currently have to rely on having a manager that is informed, compassionate and invested in committing to these policies and staff wellbeing to see the results? So this is the unintended consequences of it. Any thoughts on that? How do we close the gap between policy and on-ground reality?
My view is it has to start at the top. That if the leadership isn't acting like they actually are invested in this, you can write all the policy in the world, but if you've got people who are doing the exact opposite in terms of leadership and role modelling, that you actually do care about this as an issue, that's my view. It has to absolutely start from there. But also that you have accurate data and you're responsive to it, particularly if it's not good data. Like that is going to be the reality for a lot of people when people are confident to report workplace sexual harassment. It isn't good. We know it isn't good. Look at some of the sectors. So it's actually recognising that and being honest and then doing something about it from the top.
And I think you were saying to your very first intervention, you had good data, you had longitudinal data, so you were on firm ground when you moved forward.
Yep.
Yeah.
I think it's also the culture of the organisation as well. You have to start definitely from the top, but I think it's also setting out some really clear, objectives around what culture of the organisation you wish to have, and being really strategic and proactive about it, rather than just see what happens, and setting out some really clear kind of markers for people to understand this is what we do here and this is how we do it.
Well, it's too late once it's happened, isn't
That's
it?
right.
Then you're really playing catch up.
Some practical advice to that one. We have regulators around Australia have contributed to a tool called People at Work, and it is a psychosocial hazard risk assessment tool. I've conducted it in my organisation, so speaking from an employer's perspective, it's actually a confronting thing to do, because what you get back is a report telling you where all the risks are in your organisation. So we need to be open first about accepting that all of our organisations have psychosocial hazards, and if we conduct this tool, and then we've conducted it now twice, we're about to go on our third round, and each time we've had significant improvements in our organisation by running this tool. So I would say have a look at, get on to the WorkSafe ACT website.
Don't even need to write
Click
that
on
down
the link
anymore.
to People at Work, conduct the People at Work tool in your workplace, and be open to what the results are going to be. Because if we remain closed on this issue, we're not going to achieve anything. And part of the problem is that we fail to recognise that we need to risk manage psychosocial hazards in workplace in the same way we risk manage physical hazards.
Now this is a bit of a long one, and I want to honour the effort that's gone into questions, so just let me read this one out. The dangers of psychosocial safety for the legal and medical professions are well documented. Both suffer gender-based harassment and impossibly long hours of work and burnout. Listening to young professionals' complaints, there is a fact of life that the burden of proof is theirs to report. Until legislation catches up to whistleblower protections, young professionals will continue to risk their livelihoods for which they have studied long and hard for. Has there been any thought to aligning the whistleblower protections to those reporting their injuries? So we're looking for a link with the particularly younger, more vulnerable workforce. Any comments?
There is a provision in the Workhealth and Safety Act that provides that whistleblower protection if you make a complaint to the regulator. The difficulty with that provision is that whilst one of our inspectors can go out and ask questions and inspect the workplace, we can't necessarily follow up an individual complaint and prosecute without that approval from the person who comes forward. But we absolutely can go in and start asking the questions and making sure that they have those mechanisms and processes in place.
So again, it's back to awareness in
Yep.
the first instance, it's back to mechanisms for reporting,
Yeah.
it's follow-up information, but again, we loop back around to, we then do have to potentially reach out and let's make that next follow-up intervention less triggering than it might otherwise seem to be. Any other thoughts on the particularly young, new people to the workforce that you might be dealing with?
I think the introduction, I'm really excited about positive duty being introduced to actually prevent sexual harassment, and I think that has application when we see the impact of that, and when employers, and when boards, when the people are actually held accountable to eliminating, I think that will be applicable in other psychosocial hazards, and should be something that we should look to as a mechanism to eliminate, not just to, as Jacqueline was saying, say, oh, there's EAP if somebody made you feel uncomfortable. It has to be beyond that.
And can I say, because it's one of my bugbears, that wellbeing programs do not equal healthy and safe workplaces.
Understood. So we literally are now in our last 4 minutes, and I need the last 2. So, so to you, Sian and Tracey, what are 1 or 2 things that you wish you had have known when you started to focus on the regulation of psychosocial hazards?
I came up with a couple of things. I think, firstly, moving from a clinical practice expert into a regulation system, understanding how it's a different approach and different way that you work with people. I think certainly in my experience, I'd worked for years and years in capacity building in New South Wales, and worked with disability providers and trying to get them to do the right thing because it's the right thing and all those sorts of things. And you can do that as much as you can, and you bring most of the people along with you. But there's always a certain percentage of people who don't just go, and just keep doing what they're doing anyway. And without regulation of those things, I think, and having some of those compliance and enforcement powers that you do have in a regulatory space, I think that makes it a better system, hopefully, to kind of get those pockets of people that are just non-compliant at all and have no desire to be, kind of moved in the right direction, prodded a little bit better, I guess.
Thank you. And Sian, your call to action?
Look, I think my personal reflection is, what I'd like to know more is at the moment we've got we're new as a regulator, we've only been around for a few years, the space is new and it's growing. I think we still have a lot to learn about the market and how it's emerging and what's happening in that space. We have both unregistered and registered providers. So as a regulator, there are bits that I'd say are kind of blind spots for us that we've got a lot of work to do on. So I feel like that's the real kind of knowledge gap for me that we're working on very hard.
Thank you. And again, 1 or 2 things from you, Francis and Jackie, but this time on, what's some things you wish you had have known when you started the co-design journey?
Oh, I wish we'd met one another sooner, actually, because I've been trying to get somebody who's got some regulatory power to work with me on this issue for a while. But no, I think it really that how we can then support people to take psychosocial injuries as that it is just because you can't see it, it does not mean that it is not having such a significant harming impact on people. And I think we'll start to see more and more of this, coming through as people hopefully feel supported to report. And from a gender perspective, psychosocial injuries, I believe, tend to be overlooked because they impact sectors that are more feminised in terms of people working in community services, domestic violence, homeless services, healthcare, hospitals, teaching, disability. Hospitality, retail does have a gendered element to it, so possibly why we haven't paid much attention.
And I agree with everything Francis said, and I'm not going to answer the question about what I am going to, because I think Francis answered it really well. What I am going to say is psychosocial hazards are not going away, and so it's time to open our eyes and face the facts. So we've had federal legislative changes that are about to occur. On the 1st of April, Comcare released their psychosocial code of practice, which is the minimum for dealing with psychosocial hazards in workplaces. ACT is about to come out. We've got one in New South Wales, one in Queensland. Legislation will catch up. Open your eyes. It's here and it's here to stay, and it's time we start addressing it in workplaces.
Yeah, thank you. I think I had a similar thought this morning when I was thinking about this. You go back to more traditional workplace safety, you know, your PPE, your hard hats, have you done the induction to get on site, how that was given lip service 20 years ago, and how things have tightened up, and now there's the positive duty of care, and directors are starting to go to jail and get massive fines. So it's taken some time, but it shouldn't take as long for this. We should be able to learn and leverage off that. So we're at that stage where I have to say, unfortunately, that's all we have time for today. Thank you again to our speakers and to the audience for their active participation with the online questions. As regular participants will know, you will shortly receive an evaluation about the webinar, what you liked, what you didn't like, what we can improve. And I can tell you, at our monthly national committee meetings, we do go through the surveys and we think, how can we make and maintain these as being relevant? So please take the time. We do appreciate your feedback. Also, I'd like to let you know that there are expressions of interest are now open in enrolment for the professional regulator. That's ANZSOG's new exciting professional development program, developed by regulators for regulators, and it involves a mix of online modules and small group seminars. So make sure you check it out. I think the other thing I can tell you is there's currently 100 ANZSOG members, agencies going through a pilot. So maybe some of you in the room or your colleagues will be doing it now. Our next webinar will be on Thursday the 20th of April, and it's on the issue of AI and ChatGPT. So what's the latest fad, a useful tool, or something more nefarious? So I think you should make sure you bring your inquisitive and appropriately suspicious rectory minds to that discussion. Please make sure you also look at our socials, LinkedIn and Twitter, to keep up to date on all of our events. So finally, I'd like to thank you, one and all, for joining us today. Thank you and all the best.